adopt this thing because we have problems with the healthcare delivery. And we to do this by using the information and communication technology to improve and expand diagnostic, treatment, preventive, and monitoring capabilities as well as user awareness and the access. Similarly, other organizations like the Pan-African Health Organizations, so other organizations like the UNDP and all these things, they have all been very active in this area of policy. Can you imagine a country like Ghana, Uganda? I just put it for just case studies to show you that how far they have gone ahead. They have already document in place and they are already in the implemented process. And Frank has spoken about the European Union structure and their vision document for 2020. And important thing that you realize that document. Who is the owner of the document? Who is the ownership? Who decides? Is the patient. My data, my decision. That's the first thing that the European Union is working on. We have the Australia document, which has been again very almost relatively new fresh, and 3 pillars: information flows, service delivery, tools, and information resources. These are the 3 pillars on which they are working, and they are very serious about the change adoption, because while you change from the conventional to the electronic system, those issues have been addressed. So Cuba. So a country like Cuba, where people think that the political situation is such that no developmental activities can take place there. But you see, Cuba has taken a lead in developing those things. The last initiative that has been taken in global level is jointly by WHO ITU. You know, ITU was the leader in telemedicine in terms of technology. They first introduced technology. You will be surprised to know that. Here also in India, the IT ministry, the space ministry, those people took initiative in the telemedicine, not the health ministry. Similarly, in global level also it is the same. It is a technical organization, they have taken a lead. But somewhere down the line they realized we have to join hands. So only 2 to 3 years ago, I think they joined hands, and they had they had a joint session in the global telecom conference, a big conference there. The WHO and ITU put up a joint show. After that, I think they have taken this initiative. Let us make a toolkit to help member countries to develop their strategies. So that is the document. I request all of you to go through this document. This is in public domain. They invite comments from all and all to give comments to make this document a final document and put in the World Health Assembly. I'm not going through this document in detail because for the sake of the time I can't cover up, but please go to the URL. You'll find all the information that has been provided in this slide. So the National Health Strategy Toolkit, why they want to follow a common format? Because I just told you a couple of minutes back that we have to think of global e-health strategy, not just national health strategy. Okay, there will be some little bit of variations in the national context because we have social, cultural, geographical, political issues. So that can be just a little customized that. But we need to have a generic framework because health is now becoming a global issue. Then the policy issues also covers so many areas. You can find the list of areas there. All are very relevant. One of the areas that they have highlighted is capacity building. Capacity building in terms of the human resources, capacity building in terms of infrastructure, and capacity building in terms of your financial disposition. This one area that has been covered in the Bellagio event, it is Group on Policy. They defined these bullet points on which the pillars of the policy, health policy stands for. And they have highlighted one area, the interjurisdictional practice. Like, you know, in the field of medical tourism, we are getting patients all over the world. So where there are issues that relate to the interjurisdictional issues that they have highlighted in this thing. And when you plan to develop a health policy, the success depends on this. Like the gathering here, we need to gather, brainstorm the policy issues. You have to also take the help of other countries or the WHO to give us the toolkit to develop the policy for our own country, education aspect, and we may have regulatory bodies in the country and also involve all the stakeholders. Again, this slide, I like you to do again thorough research when you go back home. From the URL you can take it. It's available public domain. So for the sake of the time, I have gone a little bit fast, and I thought I'll just better interact with you if you have any questions on that. You find the resources from the URL and look at the policy issues. This is very, very relevant for our country. We have never attempted to do that. What we have is, we have a telemedicine standard document developed in 2003. Then we have another document developed by the IT Ministry is defining IT roadmap for health. And we have an Indian task force on telemedicine constituted by Minister of Health in 2005. We are going very slow on that aspect. I think this is the time we have to really bring these issues at the government level to address the development of IT policy for health for our country. Thank you very much for your kind attention.
Thank you. On the go, at the same time, have a good sight on what the future must be. We have 2 minutes for questions. Anybody there? Okay. Well, you know, you can always approach the speakers during the breaks and later on in the day. So we'll end this session with a presentation by Colin Fincham in telehealth from Abu Dhabi, the United Arab Emirates, who is going to talk to us about implementing IT in healthcare and changing the healthcare professionals' mindset. Colin, please.
Thank you, Frank. First of all, may I thank everybody for inviting me to speak here today. I get around the world quite a bit and have a chance to talk to many audiences on this topic. And it's quite nice to be here in India and a slightly different audience to talk to. You'll be pleased to know that I'm going to try and avoid talking too much about technology. I think one of the important things to remember is that at the end of the day, as was said earlier, there's a patient and there's a doctor and a healthcare professional. And we need to ensure that everybody works together to deliver care for that patient. What I'm going to talk about today is, first of all, about the Wareed programme and why I can stand up here today, I hope, and talk relatively authoritatively on implementing healthcare IT. But I'm also going to talk about why people use IT, what stops them using IT, and why physicians are a particular problem. And I can say that as a physician myself, so I can perhaps say some things that others may not be able to get away with. So first of all, what is Wareed? Well, the boxing kangaroo, as I call the UAE, if you look at the shadow, I promise you'll never look at a map of the UAE again without thinking of kangaroos. The national programme for IT in the UAE, the government decided nearly 5 years ago to basically implement IT across all of its public hospitals, 14 hospitals, 68 clinics. It's the biggest IT implementation in the region. And we're live with 13 of the 14 hospitals. 14th goes live on Sunday. So I apologise I won't be here tomorrow, but I have to get back for that. And as you can see from the numbers, we have a pretty good adoption rate with 17,500 X-rays ordered a month, nearly 150,000 medications, nearly 1/3 assays per month being provided. This is my favourite quote from Frank Davis back in 1989, who said, "Computer systems cannot improve organisational performance if they're not used." We've all seen servers used as door props, or people just having a computer in this corner of their office and not using it. There's no point in having IT if we don't use it. All of the great work that's being talked about in New Zealand and here in India is all wonderful if the only people who look at it are the IT gurus. Why are we doing this? Well, this is a really good example. It's a big teaching hospital in the US, a pediatric hospital. They improved their allergy documentation by 33%. $3.1 billion are spent on drug interaction allergies every year, iatrogenic complications. We can improve that. However, we have a problem. The people that need to use this are physicians. And physicians, like myself, are somewhat difficult people. I can say that. I don't often read from a slide, but I'm going to read you from this slide. This is a slide that was a comment in the Times of London back in 1834. That it will ever come into general use, notwithstanding its value, is extremely doubtful, because its beneficial application requires much time and gives a good bit of trouble both to the patient and the practitioner, because its hue and character are foreign and opposed to all our habits and associations. We could have been talking about IT, except the computer was some 130 years away. What was actually being talked about? Anybody know? Not Dr. Ganapathy, because he knows the answer. Yeah, it was the stethoscope. You wouldn't consider a doctor today to be a doctor if they didn't have the stethoscope. All technology is difficult. We've known since medical school, all the doctors here, that you always give aspirin and beta blockers to people who are leaving following a myocardial infarction. So why do we only give 50% of patients that today? Why did it take 200 years from the development of the thermometer to first use it in healthcare in France? Anybody who thought they could overcome emotional resistance with logic was either never married or worked in healthcare. It's a difficult thing to get overcome. Nobody likes change. Everybody likes to be in their comfortable little world that they're used to doing. The only people who like change are babies with dirty diapers. Change is an evolution. It doesn't happen overnight. It takes work. You have to work at ensuring people move to new technologies. The first important thing to do if you really want to encourage change is not to tell somebody to change, but to